let me discuss first about the oral anticoagulants. Right? Let me have a detailed discussion of the oral anticoagulants. So if you take the examples of this particular oral anticoagulants, so what all we have seen, the drugs in this particular group, they include number 1, Warfarin, right? And the second drug like what we have is bis-hydroxycoumarin, that is dicumarol, right? Dicumarol. So what does this particular dicumarol includes? Bis-hydroxycoumarin. Right, bis-hydroxycoumarin. Next, the third drug what we have in this is acetylcoumarin, right? We have what is called acetylcoumarin, and the last one what we have is phenandione, right? The last one what we have is phenandione. So these are the oral anticoagulants. Now let me tell you some important point about your phenandione. Phenandione is an oral anticoagulant which will cause orange colored urine, right? It will cause the orange colored urine. Okay, next. The other important point that you should know is not only that it will cause orange colored urine, it will also cause very severe hepatic damage and as well as the renal damage. So there will be also liver and kidney damage what you see in these patients who are taking this phenandione. Now, if you take the mechanism of action of these particular drugs, right? This Warfarin, dicumarol or acetylcoumarin or phenandione, if you take the mechanism of action of these particular drugs, these drugs, they act by inhibiting the activation of vitamin K dependent coagulation factors, right? So what is the mechanism of action of these particular drugs? They act by, right, they act by inhibiting vitamin K dependent clotting factors. Right, they act by inhibiting the vitamin K dependent clotting factors. Now the question comes, what are your vitamin K dependent clotting factors? So vitamin K dependent clotting factors include, that is factor 2, 7, 9 and 10. Right, factor 2, 7 and as well as 9 and 10. Now you take these particular factors. These factors are synthesized by liver, right? These factors, they are synthesized by the liver, but they are activated by gamma carboxylation of glutamate residues with the help of vitamin K, right? So these factors, they are synthesized in the liver, but they are activated by gamma carboxylation of, right, gamma carboxylation of glutamate residues. Right, gamma carboxylation of glutamate residues. Now this gamma carboxylation of glutamate residues of this particular clotting factors will be done by the vitamin K. Right, will be done by vitamin K. So remember this point, these factors are synthesized in the liver and activated by gamma carboxylation of glutamate residues with the help of the vitamin K. Now, you have what is called as the hydroquinone form of vitamin K. Right, we have what is called as the hydroquinone form of vitamin K. This hydroquinone form of vitamin K, it is converted to the epoxide form in this particular reaction. So let me continue this mechanism of action. So in this gamma carboxylation of glutamate residues with the help of vitamin K, what are the conversions which are taking place and what are the reactions which will occur? Let me tell you. Now in this particular activation, we have the hydroquinone form, right? We have what is called as the hydroquinone form. This particular hydroquinone form of vitamin K, right? This particular hydroquinone form of vitamin K, it is converted to the epoxide form. Right, it is converted to epoxide form in this reaction. Now, for the regeneration of this hydroquinone form, right, for the regeneration of this hydroquinone form by enzyme vitamin K epoxide reductase is required for this activity. Alright, so for the regeneration of this particular hydroquinone form, what is required? There is requirement of an enzyme vitamin K epoxide reductase. Right? This vitamin K epoxide reductase is required for the formation of this hydroquinone form, and this hydroquinone form of vitamin K is converted to epoxide form for the activation of the gamma carboxylation of glutamate residues of the clotting factor. Now whenever you give oral anticoagulants, right, whenever you give Warfarin or whenever you give 𝐒𝐮𝐬𝐜𝐫𝐢𝐛𝐞, what they will do? The oral anticoagulants will prevent this particular regeneration of this hydroquinone form by inhibiting the vitamin K epoxide reductase. Okay, so what your Warfarin or your 𝐒𝐮𝐬𝐜𝐫𝐢𝐛𝐞, so this Warfarin or 𝐒𝐮𝐬𝐜𝐫𝐢𝐛𝐞, what they will do is they will inhibit this enzyme, right? They will inhibit the vitamin K epoxide reductase. So oral anticoagulants will prevent the regeneration of this hydroquinone form. So now when the regeneration of the hydroquinone form does not occur, then the vitamin K dependent factors are not activated. So remember, always there should be formation of the epoxide form of vitamin K for the activation of the clotting factors. But what is your oral anticoagulants doing? They are inhibiting this vitamin K epoxide reductase, and thereby hydroquinone form of vitamin K is not formed, and thereby the epoxide form is not formed. When epoxide form is not formed, then gamma carboxylation of glutamate residues of the clotting factors does not occur, and thereby the clotting factors are inactivated. Now, what are those particular vitamin K dependent factors? Already we have discussed. It is your factor 2, factor 7, factor 9 and as well as factor 10. Not only these particular factors, right? Not only these particular factors are inhibited whenever you are giving Warfarin. Remember, even the anti-clotting proteins, that is the protein C and as well as protein S, right? The protein C and as well as protein S. Alright, so these are the factors which are completely dependent on vitamin K for their activation. Now, one important point what you should remember here is, whenever you are giving Warfarin, right, whenever you are giving Warfarin or 𝐒𝐮𝐬𝐜𝐫𝐢𝐛𝐞, what they are doing, they are preventing the formation of the new factors, right? What these drugs do, they will inhibit the formation of, right, inhibit the formation of or inhibit the synthesis of the new coagulation factors, right? That means whenever you give Warfarin, the fresh coagulation factors will not form, that is 2, 7, 9, 10 is not formed, but the point what you should remember here is the already activated factors, they are not affected, right? Already activated factors, they are not affected. This one important point you should remember. So, already activated factors, they are not formed. Okay. Now, one point what you should know is, when already activated factors are not affected, if you take the onset of action, right, if you take the onset of action of this particular warfarin or 𝐒𝐮𝐬𝐫𝐢𝐛𝐞, it is not immediate, because already activated factors, they take nearly around 2 to 3 days for getting them disappeared from the blood. So, for the onset of action of this particular warfarin, it takes nearly around 2 to 3 days. Why? Because warfarin is just only inhibiting the newly synthesized factors, but warfarin, it is not inhibiting the already activated factors. So, the onset of action of this particular warfarin or 𝐒𝐮𝐬𝐫𝐢𝐛𝐞 is not immediate. It takes a time period of nearly around 2 to 3 days or even 2 to 4 days. Now, let me discuss few more points about your warfarin. So, before discussing, let me shortly revise the mechanism of action once again. Remember, these drugs, they act by inhibiting the activation of vitamin K dependent clotting factors. These vitamin K dependent clotting factors include factor 2, 7, 9, 10 and as well as the anti-clotting proteins, that is protein C and as well as the protein S. And these factors are synthesized in the liver and activated by gamma carboxylation of glutamic residues with the help of vitamin K. Now, if you take in this particular reaction, the hydroquinone form of vitamin K is converted to the epoxide form in this reaction, and regeneration of this hydroquinone form by enzyme vitamin K epoxide reductase is required for this particular activity to occur. Now, what the oral anticoagulants will do? Oral anticoagulants, they prevent this regeneration by inhibiting vitamin K epoxide reductase, and thus vitamin K dependent factors are not activated. So, the point is, as already activated factors are not affected, the effect of these drugs depend upon disappearance of already activated factors from the blood.